Welcome back to The Fettle. Don't forget to be a part of this show by following all of our social media handles displayed on your screen. You can put your questions, your suggestions, or whatever you have there, and we'll get right back to you on that. Before we went on that break, the doctor was telling us about hepatitis, the different types of hepatitis, and how they are transmitted. Now, doctor, you've used one word that has been, really, really common amongst all the things you've said, bilirubin. What is that, please?
Okay, bilirubin is basically secreted it is produced in the liver, stored in the gallbladder secretion. So it also help with metabolism of things we take, including drugs.
Including drugs,
Including drugs. So now, in cases where the liver is diseased, so this cannot be metabolized after use. So it's in the blood system. You can't excrete it. It's not metabolized.
You mentioned that hepatitis is a viral infection, right? Caused by viruses and all that.
Hepatitis B. Because there are other causes.
Yes. Speaking of other causes, before I ask my question, please, what are the other causes? Can you, rerun them so that...
we made mention of alcoholic hepatitis.
Induced by alcohol.
We have autoimmune, where the body creates an antibody and fights the liver. We also have drugs.
Drugs.
Yeah.
When you say drug, hard drugs or the regular drugs that then people start abusing them?
Now, every drug you take is metabolized in the liver. Right? So now, when you now abuse drugs, your body doesn't need it at that point.
Yes.
So you're not taking drugs that you're giving the liver a job that is not necessary. So you're overworking it.
Overworking the liver.
We have other medications that are toxic to the liver. Even paracetamol.
It's toxic to the liver. So at the end of the day, do not take it if you don't need it.
If you don't need it, you don't take it. Because the byproduct of paracetamol, it's dangerous to the liver. So you keep abusing it. Yes, that's what I'm saying. So those are like other causes.
Eating paracetamol like is sweet and candies, it becomes a problem, becomes dangerous for the liver. When we were talking about where people can go seek help. Now, can you clarify that it has to be, the test has to be done in a facility?
Yes, if you come down with these symptoms, you should go
to the hospital straight. See your doctor, seek medical help, because at the end of the day, you shouldn't self-medicate.
Self-medication is not
should not self-medicate. Go to the hospital, get texted properly. Let the professionals tell you what to do from there on. So now my other question is, we know a lot, like HIV now, when people hear someone has a disease that is infectious, they start treating the person like an outcast. This kind of, oh no, please don't come close. Is hepatitis one of those that people should, treat people? Let me use the word stigmatization now. You hear someone has HIV and then the person is like,
there's this discrimination that comes with
it. Do people also treat people with hepatitis like that? Should that be?
Okay, I think until recent, I don't think people treat people, because most people didn't even know there was anything like hepatitis until now. The awareness just came. So I don't think that discrimination is there.
Is there for hepatitis?
And relating it to HIV. HIV, it came, this is sexually transmitted. So everybody So I don't think hepatitis hasn't gotten that level of awareness where people start discriminating. But I don't think you should discriminate.
You should discriminate.
And you cannot, it's not by handshake you pick it up. You just share body fluids. Once you check body fluids, then you can get hepatitis B.
You can get it.
Yeah, so...
I'm asking now because there was a scenario or a situation I heard about of a lady that was going to go and work in another person's house as a help. And then the madam, took the initiative of taking the lady for tests first before she starts working with kids. And then she took her for HIV tests, she took her for hepatitis, pregnancy, and all the other tests. And then she came back with hepatitis B. And then they told her she has to go. She started crying. So it felt like she didn't even know she had that, but the results showed that she had. And then the lady was like, she can't afford to keep her in her home with the kids. In that kind of situation, is it possible for her to get to, infect the kids in that scenario?
Okay. The thing about hepatitis, like I said, it's transmitted through blood.
Through blood.
And some body fluids, like vaginal secretions and semen. So I don't think it's transmitted that way.
Okay.
Yeah. people are
just
scared
by carrying the children and
just carrying the
taking care
children,
of them,
but just
she's
that
not going
she's
to be
not
able
going
to
to
infect
transmit
them.
it.
Okay.
She's not going to transmit it. The only problem people, for most helps, they'll be in the kitchen.
Cooking
They'll use sharps and all that. I think that's where the fear is coming from.
Okay.
So by the time they are scared, the person has a cut, and the baby plays around, has an injury, and brushes.
Okay, so when there is an injury on the skin too, it's possible to get it. Okay.
Because you have access to the vessels, so person can be transmitted. I think that's where the fear is.
The fear is, but other than that, it's not something that by carrying or having body contact.
No.
Okay.
No.
Okay. So is it curable? Any of the hepatitis, any of them, are they curable or they are?
Okay, for concerns, B and C.
Okay.
Are not curable.
Hepatitis B and C are not curable. So anybody who has that will have to, live with it for the rest of their lives.
And let the body. What we do is that reduce the viral load. The body does the rest.
Okay.
People actually, I've heard cases, but not proven studies. Okay. But people still recover from it.
From it. Okay.
So you just take your drugs, do the lifestyle modification as advised by your doctor.
By the doctor. And you are okay.
Yes.
But the A, the D, and the E, those ones, they are curable?
No, D is also part of the blood transmitted. So A and E, yes,
are curable. But B, C, and D are not curable. So, but when people have that, other than going to the hospital for, what do you call it now, the lifestyle modification you talked about, are there other things they can do?
I think that's basically
that is just it.
That's basically
when anybody has that,
if
that diagnosis is there.
If you have the diagnosis, you are placed on the medications. You do the lifestyle modification as advised by your doctor.
Other than that, there is nothing else that can be done.
I don't know if you have.
But really, we have to emphasize this because people will go and say, I know things that you can take that can help you out. You can take these, they'll mix, especially people who tell you, let's go the herbal way, let's mix this concoction and that one for you. Yeah. So at the end of the day, people need to know that other than you going to the hospital, getting tested and getting, prescriptions from the doctor, do not, go any other way. That is the only help that you can get from there. So we were talking about the mother-child transmission. Okay. So how can it be prevented in pregnancy? For example, a woman who has hepatitis B
and then got pregnant.
Yes.
What you do, I always relate it to HIV because that's where most people have common knowledge about. So what you do, you are pregnant, you have hepatitis, you take your drugs. Okay. Reduce the viral load. Okay. Because it's at the point of delivery where there is that mother to child transfusion.
Oh, not when the child is in.
No, not when the child. It's at the point of delivery.
Okay.
Usually transmission is at the point of delivery. Even in HIV.
Okay.
When you're done delivering the child.
Okay.
That's when there's that mother to child transmission. So if you are pregnant and you have hepatitis and you are diagnosed, just take your drugs.
It means that at that point the child is still safe.
The child is safe.
It's still
the child
protected
does not have it.
Okay.
So, but it's at point of delivery. At the point of delivery, your viral load should be low.
Okay.
So that by the time you have that mother to child transfusion at delivery, the viral load is not enough to cause the baby harm. And basically, and there are other preventive therapy or things we can do. The child now doesn't come out with full-blown infection.
Okay.
So, yes.
So when the child comes out, they take the child for medical treatment immediately?
There are other things we do.
Okay. The child will be taken care of immediately. Another thing I want to ask now, I also saw a woman in the hospital one day who said I saw her run into the lab. I'm like, what's going on? She said that she came for, her husband was supposed to donate blood before she gives birth. And then they said the husband can't because when he was screened, he showed that he had hepatitis B. Okay. Now, my point in my head, I'm like, okay, if a man has hepatitis B and he's the one that impregnates this woman, is it possible that during the implantation period of pregnancy and all early stage of pregnancy, is it possible for the hepatitis to have been transmitted to the baby? Because it's from the man, it's not in the woman right now.
Okay, I said earlier on. Yes. I said that you have to there are other tests we do. There are panels we check to see if somebody is infected or not. Okay. Doesn't mean you have the antibody, the antigen is present in your body means you have you can transmit it. Okay. You understand? So there's a level it gets to.
It gets to before transmit. You can now transmit.
So the man might have been in an inactive state.
Okay,
at the point of coitus or getting pregnant. So it's very unlikely.
It's very unlikely that the baby would have that. Okay, so that is what we want to talk about on hepatitis today. We're talking about lifestyle modification. Please, can you re-echo that? Yes.
Okay, the lifestyle modification. So I'll start from alcohol. It's a red flag.
Red flag.
Because already if you are infected with the disease, first and foremost, and you now take alcohol, it's a double damage already. So alcohol, smoking, then nutritional modifications. Okay, like I talk about eating healthy. Okay, like vegetables, fruits, immune boosters.
Does exercise come in there too?
Exercising benefits almost everything.
Everything. Okay.
It cannot be overemphasized.
Okay, so as you're eating healthy, try as much as possible to work out, do some workouts, take walks, jogging, and all the other exercise that you can do to help your liver. Because at the end of the day, the liver is just what you have to take care of every other thing inside your body, do all the cleaning. Or isn't that what the liver does? Doing all the...
It processes most things we take, including drugs.
Detox and all of that.
Yeah, and takes the toxic ones out.
Toxic ones out. Because once it is inflamed and is infected,
that function
is deranged. And then the person starts having all the symptoms of hepatitis and all of that. So please take care of your liver. It's a very important organ. Okay, doctor, quickly before we go now, what are the severe complications that can come with hepatitis?
Okay, I say that hepatitis is like one of the commonest causes of chronic liver disease.
Okay.
Yeah, so that's a complication one.
That's one.
2, cirrhosis.
Okay.
The liver becomes hard.
Okay.
It's hardened, so that's what we call liver cirrhosis.
Okay.
We also have, it can progress if not treated. So hepatocellular carcinoma, that's cancer.
Cancer. Oh, wow.
Yeah, so it proliferates and becomes cancerous.
Okay.
We also have portal hypertension.
Okay.
Yeah, there are other. So that's another
complication from hepatitis.
Yes, and you see people come down with ascites.
Okay.
Yeah.
When we were talking about hepatitis A, B, C, and D, you separated A and E. It feels like those are the lighter ones. Then.
Yeah, they are more acute. If you have it, it's like a flu. Let me use that.
Okay, it's like a flu.
Okay. Yes, let me use that scenario.
It can be treated.
It can be self-limiting. You can have it and it goes on.
But when it is B, C, and D, then you have to seek medical help.
Yes.
So, other than these hepatitis, are there other form of liver infection that is really severe and can harm the body?
I can't think of any other because most of our emphasis are always on, funny enough, just B and C.
B and C, yes. Okay.
Others can just make things worse, like the drugs, the liver, toxins, and all that. Okay. So I don't think they're...
All right. When you see some of the symptoms that the doctor has mentioned today, try as much as you can to seek medical help. Well, that is all on the Factor today. Thank you so much, Dr. James, for sharing this very insightful knowledge with our audience today. I've learned so much today, and I'm sure somebody out there has as well. Till I come your way again next time, stay good, stay healthy. Bye-bye.